Why does it do this to me all the time? Are we live? I think we're live. Let me make sure. Because
Was
it was.
live.
Yes.
Look at her. She had to get in. When you said,
All right. We are live, ladies. So let me.
hi, this is professional. Hi.
Okay.
She got to be on.
All right. So I'm so looking forward to today. So before we talk about what we're talking about today, let us introduce ourselves. I will start so that I can go and share into the groups afterwards. Hello, everybody. For those of you who do not know me, I am Shabreon The Advocate, aka Shabreon Howard, aka Chef Shay Made It. I have a lot of AKAs, but that's because I wear a lot of hats. Um, Something like, filmmaker, photographer, graphic designer, motivational speaker. We'll just go from there to I am a mother of a beautiful 8-year-old sickle cell trait warrior. I am also the daughter of a sickle cell patient. My mother passed away from complications of sickle cell when I was 7 and she was just 25. Um, yeah, so that is pretty much who I am in a nutshell. I left some stuff out, but just Google me. It's easier. Okay, so Felicia, do you mind introducing yourself, please?
Sure, not at all. My name is Felicia Hunt, aka Mama Fifi, proud owner of Sex Coaching, and Sex Education Services. I am also a sickle cell warrior, advocate, and a mentor. I have a wonderful 36-year-old son, sickle cell trait warrior, and I'm glad to be here celebrating Sickle Cell Awareness Month with you all. I'll pass it to Nita.
Catch it. Hey,
Hey.
Nita Thompson, aka Nita T. I'm a sickle cell educator and advocate, and recently got the nonprofit started, World Sickle Cell Federation, where we just in chat. We're gonna solve some of these sickle cell misunderstandings. Glad to be
Awesome.
here.
Absolutely. Okay, ladies. In case I forgot, I did not say it is September is Sickle Cell Awareness Month. For those of you who do not know, there are people who don't have sickle cell who watch the video. So I want to appreciate y'all real quick. Thank you for watching. And also, if you didn't know that, go ahead and put it on your page. Just September is Sickle Cell Awareness Month. Let people know. Um, if you need a fact, we got facts for you. Anywho, today we will be talking about the topic at hand is I am not your sickler. Hmm,
Yes.
that is a very
Very good topic. Now,
yes.
this came up yesterday in the support group I was in yesterday.
Did
And
it?
I was like, we were just talking about this word sickler. And I was expressing to me versus what you had said, Shabron. I said,
Mm-hmm.
to me, it sounds like it was calling me a sick person.
Mm-hmm.
So I'm not a sick person. Like, don't label me as someone sick. I can still have a quality of life, right? And
Yeah.
have had one, a fulfilling life. And so, to call me a sickler, it's like you telling me I'm a sick person. So that's why I didn't. And your reason, which has the social justice piece of being close to sounding like they calling you that N word, and
Okay.
so right. So some people agreed. It was like that is what they saying too. They agreed to both, like, you know, that's what it's like, because the Black Panthers had a lot to do with the first ones being supportive of sickle cell. So it has some racial tension around it because they were the first ones to start the food drive and feeding people and doing the blood drives and everything, testing our people. So of course, why wouldn't sickle cell disease have this type of negative connotation around it when it was a part of fighting for freedom as Black people and getting good health care.
Yes.
So we just have to educate people like, no, don't say that word.
Yeah, and you know what? I was one of those people a while ago, like, and still in some ways, I'm not, like, the word never, like, pissed me off. Like, it'll really, some sickle cell patients, it grinds their gears, okay? It cooks their grits. It overcooks it.
Mm-hmm.
Y'all gotta excuse my my words.
We get you. We get you. How about chafe your head?
Yes.
What do they mean by sickler?
What do you mean? Yes.
And I don't know if everybody asked them, because I know when I do, or look at them sideways, I'll get different responses.
Mm-hmm.
Yeah.
I think it's just lazy tongue, though. They don't want to say patient diagnosed with sickle cell, so they have to shorten it.
Here's the thing.
I don't want to be those things that happen out on the freeway. It's a sickler.
Yeah, I just don't want to. My mom named me. I have a beautiful name. You know what I'm saying? Call me that. Call me Shabreon. Call me Shay.
Right.
Hell, call me Bree. If you feel if that moves you. But what we're not gonna do is you call me anything other than that, because at the end of the day, sickle cell is not who I am. It's what I have.
Exactly. Yeah. Totally agree. Today in my physical, I went to a new facility.
Mm-hmm.
And I don't know if she was a PA or a general practitioner or whatever. And I told her I had sickle cell disease, SS. She said, "Oh, that's not prevalent anymore." Like, it made me feel like she was like, "You ain't relevant anymore." Like, I was like, hold on. Oh, we're very relevant when we are prevalent. There's a lot of research going on for sickle cell patients right now. So I don't know where you've been, but we're very relevant and important right now. So yeah, they still saying it's a rare disease, but more people than we actually know have this disease. And so we're working on it, getting the word out so people can understand and treat us just like they treat the cancer patient. We want to be plastered and known everywhere.
Yeah, it's like, what was she doing? Dismissing you because you come in there and you're telling her what you have? Your diagnosis?
Why even say that? Why do people think that's good to say? Why do they think, even like, we're talking about sickler, okay? Even like that word, or even like when they're trying to find a vein and everything, people are not aware of, oh, your veins are this and your veins are that. Look, I don't need you to tell me what my vein, do your job. It's like talking negative about the vein is not a good excuse why you can't get them. You're a professional. You should be able to draw an IV. You should be able to find my vein and do it. And I'd be telling them, look, you really not going to get no blood. Keep talking negative about my veins. It's like they hear you. And so they will not work for you. So if you want to get a draw, talk positive to my veins, right? So you can get the blood you need. Watch what you say.
Stroke them.
It changed people's moods as a professional. Watch what you say. That's all.
Words are powerful.
Words are very powerful. That's why I say you're not gonna dictate my life with your words. You're not gonna tell me my veins are bad because you say they are. I know you can get blood out of them because I say you can. I
Yes.
got the power over my body, just like with that word. So just be aware. Just in the professional field, be a little sensitive. Have some compassion.
Yeah, you know what? I've
Think
never
about
heard a doctor come in and say, "Hey, you diabetic," or "Hey, you
right.
cancer." Why?
Right. Hey, you cancer or whatever. Or hey, you know, like you say,
Hypoglycemic.
like making fun of people with lupus. You know what I'm saying? Saying derogatory words. You don't do that to other people.
Yes. It's hi, Mr. or Mrs. or Ms. or hi. How you doing today?
Right.
Up. I reviewed your chart, Mr. or Ms. It's not you sickler. That it really seems very derogatory.
Right.
It really does. So I've heard that, well, you don't act like the normal sickler.
That's the
What
one.
is the normal sickler?
That's the one right there.
What's normal? Tell me what's
It-
the standard of having sickle cell, and then maybe we can get somewhere.
You're
Because
not like those other sicklers.
yes. Well, you're
what
not
does that
screaming.
mean?
You're not screaming today, or you're not cursing me out, or you don't act like you're in a lot of pain. Well, maybe I'm not, but it doesn't mean someone else is, and we need to be even compared. You
Well,
know?
just because somebody is crying, moaning, screaming, or whatever, don't mean that people are putting on the act. You take my cells. You let my cells clump together in your body the way they clump in mine, and you take that pain. See how it feels. Okay. Some of us may know how to control it a little better than others. And so you think, oh, you're not like those sicklers or whatever. No, honey. It's like just because I choose not to have a fit because it makes my crisis worse when I cry. And if I get to that point, that means I'm really in pain and I feel like you're not helping me. And so I will cry. I will do whatever I need to do to get you to understand I'm in pain and I need pain medicine. And the other thing, because of this opioid pandemic they having, they giving all these opioids to people who got that good insurance and making them drug addicts. So the people who have these genetic disabilities that need the opioids, they treating us like the drug addicts they created. See, these doctors out in Hollywood and everywhere else is creating these patients to be addicted to the opioids and giving them high dosage. And we're asking anywhere from 1 to maybe 8 milligrams or something like that. No, they're giving double digits. Honey child, they just reported it on TV. They were giving Michael Jackson over 300 milligrams of Dilaudid. You understand what I'm saying? That's ridiculous. So it's like we got to pay for all of that because we have a debilitating disease that causes us to need the opioids. And then they want to push off these neural drugs, neuropathy, or drugs that deal with the nervous system or the nerves. Those are different pains. That taking care of a nerve pain is different than a bone, a joint, and a muscle pain because we can have crises anywhere in our bodies, in our head, anywhere the blood flow, we can have a crisis.
Yes.
And that's
Absolutely.
why we need the opioid so it can shut off that, inhibitor that says, hey, you're not in pain anymore. And that's what it does. It deals with shutting off the receptors and stuff that say signal pain, 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 pain.
Yeah, it's a
Then
mask.
then you don't want to give us that so that at least our bodies can be tricked into feeling like there's no pain so we can get better.
At least lower the pain level so that you have to be tortured.
So that the oxygen and the IV fluids can do their job to loosen up those blood cells to flow more properly until our bodies generate more red blood cells that are more healthier to survive.
Yes. The other thing, though, is when doctors talk and nurses talk about sicklers, it's interesting by race how they don't necessarily call Latinos or white people or Asians sicklers.
Girl, you mean to tell me all them other people got sickle cell too? It's not a black disease.
It's just not a black disease, but it may be a lot of African Americans in America.
Right. Yeah.
We talk about Asia, we talk about Vietnam.
Come on now.
When the brothers went over to Vietnam, they had sickle cell trait, and Vietnam had sickle cell trait or thalassemia trait. And all of the babies left over there, many of them blended, had some sort of sickle cell.
That's right. Yeah. And that's another thing. There are different types, and then they want to make one better than the other, one less than the other. No.
So how do you feel, or how do you deal with being grouped into that? Like, instead of being looked at as an individual, they're coming at you and saying, oh, most sicklers are, most patients. Like, I know the one time I had a crazy hospital experience. I was in ICU, like it was crazy. And so literally the day after I got out of ICU, the doctor tries to cut my medication. She comes in. She waited until I was by myself, and she came in and she goes to say, oh, you shouldn't be in pain anymore. You mean the day after ICU? Like right now, today? You think I'm supposed to be done? So, she was like, yeah, because most sickle cell patients, they only in pain for a week. It's been 9 days.
Yeah.
Who are you talking to, ma'am? Because first of all, my name ain't most patients. Okay. Secondly, what one patient goes through is totally different than what I'm going to go through, because my biology is different. My genetic, everything about me is, if I had a twin sister who had sickle cell, right?
Yes, it's not the same.
That person is still going to have sickle cell differently than I have it. Okay? We're not going to, no two people, they may have similar experiences, similar sickle cell experiences, but there is never going to be one with the exact same ever.
No.
Somebody said that, they
lied. I used to think, like, I used to be like, I go in, I don't have to be here no longer than 3 days, and I know what I need. This is me. I know what I need. Blah, 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 blah. Until one time I had a crisis, and I thought 3 days was enough, but it wasn't. I was there for 7. That was the longest I had ever been. And after that, I've been there longer than that now. Before I thought 3 days was it for me.
Listen, okay. My longest was like 2 months. And listen, so coming from someone, when I was a kid, I don't have the same experience that most kids with sickle cell have when they talk about being small and having to be in like the crib and all those experiences, having to like, I don't have a young childhood hospital experience, because when my mother was still alive, she was amazing. I mean, there is no other way to put it, because it wasn't like I was suffering at home and I never went to the hospital. It was, she knew just what to do. She knew how to take care of me. She was very effective, and she knew how to get me from point A to point Z without interfering. She may have to take me to a doctor's appointment the next week just to be sure I'm okay, run my labs and stuff. But other than that, I didn't see the inside of hospitals. When most, and I'm not saying it like, but it's because I think because she had sickle cell, most parents, when they don't have that type of experience growing up, and you don't know what to do. You don't know what cues that's like, okay, this is hospital worthy all the time. Like, so you rush to take them because you're afraid like something crazy will happen. Well, my mother, my grandmother, like, they had already been through that with her. So, it was certain points where it was like, okay, we know what to do. Boom, this is what we do. This is how we handle it. And so at the end of the day, I didn't have that. I didn't start going to the hospital, to be honest, until around the time I hit puberty.
Yeah.
That was my downfall. Um, yeah, like, to be honest, I now, looking back on how many people can say, oh, as a kid and how all the stuff, and even doctors, I'll say, oh, probably when you were a kid, and it's just like, you can't compare me to other situations because mine was totally different than most people, because I actually had a parent who had sickle cell. A lot of people don't. It's not it happens, but it don't happen often.
Right.
So,
Well, like, some people don't understand that each sickle cell experience is different. Now, me as an advocate, I hear from a lot of my patients. Now, there's a gentleman who's 83 years old. And he told me, and just think, 83 years old, so way back then when they weren't treating people effectively. But he's like, I know when I get out of school on Friday, I'm going to go out and play. Saturday, I'm going to hit basketball court. And Sunday, I'm going to be in the hospital to get ready to go back to school on Monday. And that was his routine. But he was fine with it. The other thing about it, though, is some people are not diagnosed with sickle cell until their autopsies. So if that's the truth, they have to understand, and they are the medical community, that it is an individual experience.
Yeah.
It is, because the pain tolerance, our pain tolerances are different. I mean, I can probably tolerate a level of pain that Shay can't. Shay might can tolerate a pain that I can't, whatever. And with all the sickle cell patients, we all have our pain tolerance, right? And so therefore, when they talk about dosing us, they can't even say, well, I give my other sickle cell patient this, so I'm gonna get it. They can't even do that to all the sickle cell. You gotta prescribe that program of medicating your client or your patient according to what their bodies need. You give me 4 to 8 milligram of dilaudid, I'm dead. I know it. Okay. I can't do that. Okay, that's me. I don't judge anybody else. 1 or 2 for me milligram, hey, I'm good. It's enough for me to work with my pain. But somebody else, like, that don't even touch it.
That is correct.
That don't even touch it for them. They need at least 4 and other stuff to go with it, to eat, just to touch it, just to diet down a little bit. You see?
Yes. It may also depend on how large a person is or how their bodies
metabolize.
Yeah, metabolize.
There's a lot of factors.
Exactly. And distractions. So don't let us get away from distractions, because people are punished for doing what their pediatrician taught them to do, taught them very well
to do.
Distractions. But yet adult doctors want to say, and nurses, well, if you're talking and you're laughing, you can't be in pain. And you're certainly not in pain when you're asleep. It's like, come on, learn something, instead of just assuming.
Right. And that's why they can come up with terms such as sickler, because they looking at you like you a different or other or something. So they, they want to label you that word because of all of these things. And you have to have something in your mind about your patient that you see that's not good when you're not giving them the best of care. Everybody deserves the best of care, period.
Yeah.
Why do I have to go like today to a physical to hear a doctor tell me that I'm make me feel like what I got, I'm not important? Oh, that we don't, that's not prevalent, anymore. Like what? Like so what
Yeah,
are
yeah.
you
It's very much prevalent within my body, so I'm not trying to hear none of that, ma'am, sir, whoever you are.
whoever you are? I hope she get a influx of sickle cell patients come in now. And she
I
gonna
just
be
wish
like,
sickle cell on your practice.
you understand? So you can learn, like, oh, I thought this wasn't. So everybody can come in and teach you something.
Yeah. And also, you know what else though? Is I see a lot of like, okay, so we're talking about distraction, right? So I how do I put this? It's kind of like you feel like you damned if you do, you damned if you don't, because I have had nurses that because everybody knows I work, honey. I work. So some may call me a workaholic. I don't think I'm a workaholic. I think I just, hey, mind your business.
What she say?
She said, yes, you are. So I have had times where nurses have treated me differently because I am working. So they're like, oh, how sick can you really be? Then I have had most of the times they're treating me better because they see me being productive and working, and they're like, oh wow, you're into this, you're into that, oh wow. And it's like, oh, what you think I just sit at home eating bonbons until I just was like, yeah, let me go ahead and head out to this hospital real quick for this vacation? No.
Exactly.
I've actually been told that too before, that the hospital is not a vacation spot. And it's like, it's not. I don't ever. The hospital is jail to me.
Who
I feel like
wants
I'm
to
turning
go to the
myself
hospital
in.
for a vacation?
Right.
Oh,
I'm going to jail. That's what I feel like. I feel like I'm turning myself into the popo. And they tell me when to eat, what to eat. You know, they tell me how to
wake
take
you up
my
in the
medication.
middle of the night. You can't get no sleep. They wake you up early in the morning. You can't get no sleep. Testing you. Let me take your blood pressure. Let me do. You don't get no rest in the hospital. You can't rest.
No.
And
So
when
it's
you're
like, where's the vacation at? Because I don't see it. Please let me know.
you are in pain and they're late with your meds and they think it's fine.
Yeah.
Well, I don't think they're really in that much pain, so I'll just come back in about 45 minutes. And they don't understand at all that they're increasing the pain. Then it's going to take that much more medicine to get the pain down again, so it's somewhat controlled.
Or at least less, more around the clock to get ahead of it.
Yes.
Until it can die down.
And I think that's why I'm fortunate, because it took a little while, but when I first moved out here to El Paso, I only had my primary doctor for a while, and then I got my hematologist. But the good thing about my primary is that she's a hospitalist as well. She has rights at a hospital, at a private hospital. And when I tell you, if I went there right now and I was in my worst pain, okay, and I'm telling you what I usually take don't work, it's not working, we need to increase the frequency and the dosage.
Right.
She would not be like, oh, no, we can't do that. She would be like, okay, what do we need to do? How do we need to do it? And then,
Because
she's the type of person, she understands my situation.
Right.
the fact that I don't have a big support system where I live. So she knows I gotta get back home.
Yeah, you got
Okay.
a child
Trying to get
to
me in and
take
out, in
care of.
and out.
Yeah.
Especially when COVID hit, she's like, "Oh, 2-3 days, cause what you need?
Right.
Okay,
Yes.
increase. Okay." And that's that. Like, and it was to the point where the nurses would be the ones like, I have to call the doctor because I don't feel comfortable. And then like I'm looking at them, I'm like, you're gonna call my doctor, who I know, who has been my doctor, and tell her you don't feel comfortable giving me a dosage that she gave me.
Charge
Why,
nurse.
why
Well, for
do
you, not for me.
why do they have the right to do that, especially if the doctor put the order in?
So and then so what I find that they do is they'll bring it late, or they'll try to, flush you through my, it's just different stuff that they do, like trying to be petty about it. And it's like and it's like, and if I tell the doctor, you're gonna get in trouble because she is actually my doctor. This isn't someone who, I'm just meeting and she doesn't know me and she don't know my case. My doctor would be so proud of me every time I go to my appointment. I'm doing something new. I got some new thing I'm into, and she's like, "Listen, we're trying to get you as healthy as possible, keep you here as long as possible. So whatever we need to do, we'll do it." And so even with my hematologist, like there has been times where he has like partners that will come and try to change up what he ordered.
Yes.
And it's like, if my doctor, he has like, because I do the direct admit, because I get blood exchanges. So he has everything, medications, oxygen. Literally, if the doctor is if the hospitalist is on their job and just don't have an ego, I've literally the last time before this last time, the care team I had, my doctor literally came in and was, well, the not my doctor, but the hospitalist came in and was like, um I don't even have a job. Like my job is easy. Your doctor did everything. All I have to do is look at the notes, look at the orders, put it in. He's
Follow
like,
directions, son.
yeah, exactly. He said, that's all I have to do. He said, if you need anything extra, that's it. Like he was so refreshing to me because it's rare that you would just get it. It's always when I go there, it was always like there was always this hesitation from other doctors because they want to do things their way. They want to feel like they've, and it's just like it's easy. It's
Yeah.
so easy that it's a literal thoughtless job. Like you have to want to be in the way to
Mm-hmm.
actually prevent me from having the care that my doctor wants.
Yes.
And it's
I
crazy.
just don't understand.
Hey.
I mean, I'm hearing so many stories. Hey, Master. Um,
Hey, how y'all
you
doing?
know, from a lot of other sickle cell patients who right now, one, not right now, this moment, but it was maybe a few days ago, a patient had that same kind of treatment. A doctor say yes on a medication, and then another doctor run interference to
Yeah.
not feel it, and then that the patient have to then go back to the same doctor who okay it, they okay it. The other doctor run an exception on it because they want to put that person, this other doctor want to put that person on some other medication other than what they really need
Hmm.
to help them.
Yeah.
Absolutely.
These things have to stop. It's like, why you want to give me something that is not even for what I'm going through? You want to give me something else to experiment on.
Yeah.
I know this over here work. Why do I want to become a guinea pig? You know, that's because of the way they think about this this disease in the person.
You know what gets me? What gets me is when you're asking for 1 milligram and the doctor wants to give you 0.5 milligrams and he'd rather throw the 0.5, the other, away than give
Right,
you.
because the vial.
And that doesn't make sense to me. Master, what you got to say about that?
See,
What's happening?
I had that happen before, and I had that happen to me before where a doctor, emergency room doctor. So basically here, right, it was two St. James, one Olympia Fields, one Chicago Heights. The one I came up in was on one side of town, but Olympia Fields is a different one. The one that I came up in shut down. They sent some doctors over to the other one, right? So that mean that the one that I came up in Chicago Heights one had, I knew those people, like I knew them, and they knew me. So when I went to this other one, that's what the lady did. Just what you just said. Was she told me that until my labs come back, she was gonna give me point 0.5, even though I'm like, yo, I only take 1 milligram. Like, it's not like I take a whole bunch. Like, and you can clearly look and see that, I haven't been here for I don't know how long. Like, so we waiting, and just so happened that another doctor who was coming from the other one, who was coming from the other one, now that that one was shut down, he saw me as he was going past, and he came in and he was like, hey, what you getting, you the same 1 milligram? And I'm telling him, like, nah, she said she was only gonna give me, the 0.5 or whatever. And so he tells the nurse person, he said, nah, you're gonna change everything about him. He was like, give him the point 0.1. He's normally gone within within the 3 rounds. And sure enough, when they gave me the point 0.1, I was gone on the second round. Like, but they don't understand that that point 0.5 is the difference between me staying for a round or two
Yeah.
versus 3 or 4 days. Saying, like,
Mm-hmm.
why keep me in something that you could take me out? Like, why keep me in the pain that you could take me out of? Like, that's crazy to me. And like you said, they just gonna throw it away. Like, and then it'll be another thing, right? If you see in my charts that it says normally get 1 milligram, because they tied together. They was both St. James, so they was tied together. It's one thing if it's saying my charts 1 milligram and I'm up in here asking for 4.
Yes.
I'm not asking for that. Like, I'm asking for what you see
What
there.
is in my chart?
Like, so I done had a few situations, even the whole situation of where they would come and they would say and it's crazy though, because I had it done to me where they said, oh well, the IV fluids don't work. And I'm like, what? Like, the IV fluids don't work? Well, studies from Chicago, from University of Chicago, showed that the IV fluids don't work. Well, I wasn't a part of that study.
That's right.
So unless you got me up in that study somewhere, go ahead and set that up for me. Yeah. So I had a few little weird things, but that's a person that clearly they wasn't treating Master Burt. They was treating sickle cell anemia.
It was sickler or whatever.
Yeah.
That's what
Yeah,
they saw. That
Yeah.
word. Mm-hmm.
I would.
yeah.
I've had a time when they told me that oxygen. They did studies and proved that oxygen wasn't necessary for sickle cell patients. And I'm like, do you know how you sound right now? I said, what is sickle cell?
Right. What
Like,
is sickle
how,
cell?
how
And
does sickle cell work?
what do cells hold? What do cells need? Where do cells get the oxygen
What is
from?
the lack here in my body
Yeah.
happening? Is it
So
oxygen?
Is it
so
oxygen?
recently,
Right.
But
so
it's
so
because I found out that because it gives you a euphoric effect. That
Oh, what? If it's
Oxygen.
gonna help with the
yeah,
pain,
yeah.
whatever. Let me tell you, when you get that that IV fluid can hurt you just as much too, because it's breaking up those cells to get the blood circulating. So
Mhm.
it's like oxygen comes in to help with that because we need it in our blood so that we can be able the retic count so we can be able to produce more red blood cells. So we need the oxygen. It helps to decrease the pain that way too, because that IV fluid alone can hurt us too. I felt it when that IV starts. Oh my God. Because you can really feel it pushing through your veins, and where that blood is thick and ain't moving, and that IV fluid get to pushing on it, that
Yep.
don't feel good either.
And don't let it be cold.
So so recently I had the same situation, but right. So to me, that whole IV thing, that was like 2000, like 14, 15 or something, right? Uh, but recently I just had it happen to my daughter, and it was crazy to me because now they're at the University of Chicago, right? So when the man, it was my kid's mother that took her, and so when things go kind of south, she'll call me if she's with her, and the way that it was like I had already took her twice that week. She already had to go to the emergency room twice that week, and they sent her home. So this time, when she called and told me like, oh, they finna send her home, and I'm like, no, they not. Like, no, they not. They not finna send her home this time. And so doctor get on, and you could tell he was young. You could tell he was a younger guy. And I was trying, I was kind of real polite with him and everything, but I was still trying to get him to understand, like, look, bro, like, I understand that you did all this reading and studying this thing. I promise you, I get it. Thank you, congratulations, and everything. But listen, yeah, my daughter, you just told me you don't have her own IV fluids and oxygen together, and she needs both of those because clearly you're not looking in her charts to see that she has asthma. Clearly, you're not looking to see that she sleeps with oxygen. You're not looking at these things. So he's saying that he feel like because of her numbers that he want to send her home, and I'm like, well, because she been there twice this week, and this is the third time, I want you to keep her. I want you to keep her for at least the whole 24 hours. Just do 24-hour observation. Everything should be fine if that's the case, right? So I said, but here's how it works for her. Her acute chest don't normally show up for a couple of days. It don't show up for a few days. She could be in a little pain, and as soon as you give her the medicine, and then she out of it, but acute chest be setting up. It be forming.
Yes.
Sure enough, she stayed that day. She ended up having to get transfused, everything. So had he just sent her home, there's no telling how that would have went. And so that's why I'm like, that's why I be saying that's what the whole topic of I'm not your sickler is like. That's all you looking at. You're not
Right.
Yeah.
looking at Master, bro. You're not looking at Imani, bro. You're not looking at Shabreon Howard. You're only looking at the standard.
Yeah.
Yes.
Yeah, don't
And
don't
what,
don't put me in the group as the standard.
Or
and
what
what
they think they
is
know. Yes.
what is the standard? You understand what I'm saying? It's like,
Yeah,
what is that? Everybody from all different doctors, they have their own perspective of that.
Yeah.
yeah.
Yep.
Yeah,
I
because
have
some people's standard is that we all messed up and we all come looking for something.
Exactly. Because I did have a conversation with a doctor, um, because a person at the time that I was dating wanted to understand sickle cell. So
Yeah.
he paid for me to go see his doctor because he wanted to know what it all involves and what he would have to do being with a person who had sickle cell disease. And I was telling him about all the stigmas and all the things around sickle cell disease and why this happened and certain things happen. And he just couldn't believe it. He said, I want you to go see my doctor. And I went to go see his doctor. We went to go see. And sure enough, that doctor validated for me what I didn't need validating, but to explain to the person I was with, he was like, yes, sickle cell disease hold a lot of racist values. He just told him because he studied in a predominantly black, area, with at a hospital that had a lot of sickle cell patients. And he said that the way that when he was learning about it, how the doctors approached it was the ones who didn't have anything going on in their lives, they were like riffraff, right? And those who had something going on in their life, then they got taken care of. And I said, you know what? I've been on both sides of the fence because I have been on disability all my life. And I told that doctor, I said, so you mean to tell me when I was not working and I didn't have no more than a high school diploma, then I come in to get services, I wouldn't get the best of care because you guys think I have nothing going on in my life. But now that I have a master's degree, getting ready to get my doctorate degree, okay, and a certified sex coach, is like, now, it's like now I get the best of care. So I've been on both sides of the fence. I got an education, and I didn't have one before. I got a business, and I didn't have one before. So that's what I said. Does that make sense to you, doctor? Does that make sense? Why can't a human being just get the best care, period?
Well, let me tell you, that person that I advocate, that's the 83-year-old, he went to the hospital in Southern California that is now closed. He went to the emergency department, and his daughter was with him, and they got home, and she reviewed the paperwork, and that, excuse me, let me stop and don't say that. The doctor wrote in his paperwork that he was a drug seeker at 83 years old. So she went right back, took the paper, and checked him.
Yes.
You can't grow out of it. You can't live out of it for certain people's opinions that mean nothing.
Yeah. So before we get too far into this, I did put out the survey last week. And each part of the survey is relevant to the series that we have going on. So I want to review the part, the I'm Not Your Sickler part of the survey. So the question was, in which ways do you separate yourself from your illness? In parentheses, it says sickle cell. So 22% of people said self-identify triggers of crisis. Another 22% said know that not everyone with sickle cell can be treated the same. So it's equal all over. Another 22% says research ways to be on top of sickle cell, not let it be on top of you. And then 35% of people said all of the above. So I think that most people know, especially once you get to a certain age, right? You're like, I know at maybe at 17, 16, I didn't know my body. I was still figuring it out, There were certain triggers, of course, I knew. But it wasn't until I really got to understand what sickle cell was doing to me, what my body was doing, how my body is a constant, changing and evolving thing. So I had to realize that my sickle cell is going to grow with my body. It's not going to stay the same. So when I was younger, no, I didn't really know too much about sickle cell in the sense of Shabreon, the sickle cell patient. So I had to go and figure out things for myself. I had to identify what those triggers was. There are some triggers that I have that pretty much that probably some sickle cell patients don't have. There's some things that will instantly, okay, without a doubt, me and the beach used to have a very much love hate, mostly hate relationship. And it was until I figured out, oh, you have to pre-medicate. It don't matter how you feel. It don't matter if you have one of the best weeks of you could be having the best 6 months of your life. Before you go to that beach, you better take some medication if you want to leave okay. And so it took a long time for me to understand that, especially as a kid. I want to go with my friends, and how many times that I had to go to the beach and figure out, listen, we got to leave early. Sorry, I'm going to be that one, and there are still like, so we have two people that lives in Cali right now. Zuma Beach is a place where they have like the fire pits, and I cannot go to that beach. I can't. I know me, and although I figured out how to beach as a sickle cell patient, that is one beach I cannot go to because it's too much smoke. And because of my sickle cell and asthma, there's no way possible to ever like avoid getting sick going to that beach, because not only am I in the atmosphere of the beach and the moisture in the air and all this, also I can't breathe. So it's too much for me. And I had to come to that realization about things. There's just different things and different triggers for different people. It's not going to always, we've been saying that it's not going to always look the same, but the key is to know what it looks like for you, what
That's right.
sickle cell does for you, and don't be ashamed to speak up about it, because sometimes, especially growing up, I've been in the car when the air was on a little bit too high, and I knew it, and I'm like, oh, I don't want to be
say
that
nothing right. Won't say, oh no,
and everybody be hiding uncomfortable because of me. But when the older I got, the more I'm like, listen, you have to cut that down to cut it off. Because
I'll take my blanket or jacket everywhere with me. And then if it's still too much, I'll say something too. But you have to find your voice. And you know what? Because sickle cell is traumatizing anyway. And then you have your own life experiences that you go through that can be traumatizing. So it takes you, when you go through any kind of trauma, it takes your voice away. And it also makes you build walls to become something that you truly not. So you might become an avoider, you might become a people pleaser, you might become a victim, you might become a controller, you might over hyperachiever, all these things that I talk about. And you think that's you, but you don't understand that's as a result of something that happened to you that makes you this way. And so until you can get a control of that, some of us, our care will never be as good as it can be because we don't know how to control ourselves or conduct ourselves when the doctors push back. We always have to learn how to remain calm. And, some people, I be in too much pain. I can Look, focus on yourself. You can focus on yourself and make sure that you're okay and you're not doing more damage to your body. However, you still, if nobody there with you, you have to use your voice to advocate for yourself until a loved one or advocate or somebody can come and do it for you. And so therefore it is a skill. It is something you have to practice. You have to remain calm. And sometimes you have to confront them with, do you know me? Little sentences like that. Or did I do something to you? Like, why are you attacking me? I feel like you're attacking me. It's like an example of what people call a Karen. Karen, she'll go off real quick and say, oh no, what are you doing to me? Why did you do? We have to do that. Like, what are you saying?
Yes.
oh my God, what did I do? You know, you have to say those things like to bring their attention, like you're treating me like an other, like I'm something else other than human. And I need to understand I'm not the person that pay your bills. I'm not the person who feeds you. I'm not the person that sleep with you at night. I'm not your friend. So I don't understand why you think you can have this attitude with me. And if you're going to continue to have this attitude with me, I don't want to speak with you. You need to bring somebody else in here that I can speak to. Oh, then they go to, oh, no, 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 no. And I was like, okay, then. So that means that we can talk because I want to let you know I'm not a drug seeker. I am in pain. Now, is there a certain way you want me to behave so that you can believe that I'm in pain? Because I'm not a person that hoop and holler and cry. That makes my pain worse.
Yeah.
Okay. So, but when I tell you I am in pain, you can hear it in my voice. You can hear it. I moan, I rock. These are my things that I do to let you know that I'm in pain. And if that's not enough for you, I'm sorry. So I need my medication now. What is the hold up?
I
I'm
want
gonna
to.
go and get it now. Okay, okay, okay. I'm gonna do this. Okay, well, thank you.
That's the same thing that children need their parents to understand. Because when the doctors tell the parents that their children are lying, that they're just lazy, they don't want to go to school, and the children are actually telling the parent should know their child
They
and
should.
believe them and check the doctor. Talk to somebody, but believe your child because children rather be outside playing, just like our adult warriors rather be outside of the hospital.
Exactly.
Well, let's be real. Not all. Uh,
Well, we don't want to be. I
I'm
mean, as
on.
children, I know I didn't want to be in the hospital.
No, I'm talking about the adults. Um,
The
but
what?
I said I'm talking about the adults. But I wanted to speak to what Miss Fee was just talking about, which was like, you know, correcting the doctors and stuff. Like I've seen over the years a lot of people go off, and sometimes I've even seen people go live spazzing out on the doctors. Like that's the cool thing to do. Um, that's crazy, that's crazy because for one, I wouldn't want to go off on the person that got to give me the same medicine that I'm asking for. That's one thing. Uh, but then also, just like the way that you were just talking, it's like it's an intelligent way to check people. You don't
Exactly.
have to be ignorant, and belligerent and all crazy, because what you do is if anybody's ever been around the person, on drugs when they coming out of that, that's what they are. So you really look like exactly what they calling you, uh, and you look like a person that is coming down, and now you belligerent because you looking for what they saying that you're looking for. So it really don't help. You know what I'm saying? It never helps nothing.
No.
It never helps nothing that you doing that.
Right, because it's only feeding that mind of what they see. If they
Yes,
already thinking you a drug seeker, you
yes,
hollering, hooping and hollering, and telling them all this and all that, it's exactly what a drug addicted person would do.
yeah, exactly,
But
exactly what they would do. Like, and
but
so it's
you got to understand people communicate differently. And when you are in pain and when people are not listening and you've done all that you can do, that's when you go, you blah, 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 blah. You need to blah, blah, blah. Give me somebody new. Get me
never, yeah, but
somebody else.
that's never going to
You
help
know,
you.
things like that.
It's never,
You
They
that's
just
never
can,
going to
never
you,
help.
I mean, you can request. It's just a way of doing. I just believe the reason I just believe because of experience of my own. Not, I don't think I'm better than anybody. I think anybody can do what I do, but you might not agree with my approach, and that's the thing. You have to believe in the approach to make it happen for you. And I just think sometimes some of us shoot ourselves in the foot and we don't get the kind of care that we need, because we don't understand how the professionals are working with us.
If
And
you've grown up in a household where all people do is curse, you're going to be a cursor. You see what I mean? That's why what we've all said is meet the patient where they are as that one single person. Understand the person. Because when
that's
you change,
true.
you're not going to change from what you are.
Well, if you want to,
So,
everybody has an opportunity to learn something new and to change it. And if that learned behavior coming up in a household where everybody is a cursor and that's a learned behavior, every learned behavior can be changed. But if you don't believe that, you won't. Okay. And so, but what you need to see though, too, is like, okay, I accept that you curse, but look, it ain't getting you nowhere because I don't like you cursing at me. That could be the doctor's stand.
so wait. So
You
because
know?
I have something I want to add to that real quick before I
Mhm.
forget, before it leaves my brain.
Yeah.
So everybody know, outside of Facebook land, and when I do this, I'm very professional, but I curse like a sailor. Okay, I do. I have for a very long time, but when it comes to my care in the hospital, the very, very, very seldom do you ever hear me curse at a doctor or a nurse. Um, and it's because I feel like I'm going to give the same respect I
I'm
the,
kidding.
I demand, because I'm going to say demand because I do. So I'm going to give it, right? Even if I feel disrespected in that moment because I feel like I'm not being heard. Because sometimes when you're in the moment, and I realized when I was younger, oh yeah, I used to curse. I go off, okay? But that was me as a teenager. That was me and my frustration. That was me having to do things on my own because there was no one else. That was just me. Um, so in that time, that's what I did. But I realized even then, I did get the results that I wanted most of the time, but I would not feel okay about it. Even when I would get what I wanted, even if I cursed the nurse out and I reported the nurse or doctor or whatever, and I still got a new doctor, everything went my way. I still did not feel okay. I was still angry. My blood pressure was still high. So I had to do some self inventory and check myself and say, you know what? There's a better way to handle this. And in me doing that and acknowledging that and holding myself accountable, I realized also that when I'm speaking to doctors, they don't care about how I feel. When I'm speaking to nurses, they don't care about how I feel like they're treating me. But if I'm talking to them on the level of which they understand of facts and rights and responsibilities of my patients' rights and responsibilities, what they are infringing upon, things like that, if I am coming at them at a level of which they're like, oh, hold up now. Wait a minute now. I didn't know you was all that. Then the level of respect that I demand is usually met, because then they're like, okay, not only did she tell me how she felt, she did she did it in a way that wasn't telling me how she felt about it. It was the fact
Or telling me how to do my job. It's a way.
yeah,
You telling
yeah.
them, but you're not infringing on their responsibility as the professional. And I think that's the key point. That is the key. And and sometimes I tell, the person I'm advocating for is like, start from home. Start putting yourself in the mindset that when you get to the emergency department, Nita, When you get to the emergency department, as Nita taught me to say,
Yes.
is to start envisioning that the person at the desk is going to be supportive. And then when you go for the triage or whatever, that all the people involved is going to give you the care. That it's also a mindset. Because if you go in with a mindset that already say you're doomed, guess what? You walk into it. You
Yeah.
walk right into it.
Yes.
But I start from home. I start from home saying that there's a, the nurse there is going to understand, she's going to hear me. I'm not going to have to wait long for a room. They're going to get me in the room. The doctors are going to understand. I should be able to, have my IV and oxygen. But I start from home.
Yes. You can
And when I get there,
Yes.
that
Please.
negative energy that wants to show up
Yes.
goes around me. Like, I'd be like, oh, I moved through this quickly. It works. You just never know. It works.
It's your perspective on life. And honestly, like before I go to the hospital, especially if I know I'm already anxious, I pray. I pray and I set my intentions. I meditate. And like you said, like I'm like, okay, I'm gonna have a great visit. Even if I might feel like, this last time was weak, like I gotta go in here ready.
Right.
But I'm still going in like, but this is a new time, this is a new day. I won't have the same experiences.
Exactly. And sometimes I go in knowing, okay, I know I feel the energy. I know this is gonna be one of those long days. So I'm gonna have patience. I talk to myself. I'm gonna have patience. They'll get me in when they can. I'll check every 15 minutes if I have to, because they usually have the sign up. If you don't be seen in 15 to 30 minutes or whatever, come let us know or whatever. And so I just practice my rights. Hey, I'm high risk. I've been here 15, 30 minutes. Nobody called me. Okay, we know we busy. We have this and we have that. As long as they talk to me and communicate with me, I'm okay. But if you trying to ignore me,
Yeah.
Like you looking through me. Oh, we just want to get all the people that's, quick out of the way. No, ma'am.
No, I come
We're not
before
doing
them.
that.
Yeah, I
We're
come
not
before
doing
them.
that.
You know what? You're not the usual sickler if you say please and thank you. And I have even known people that ask the staff to pray with them, but that's not the usual sickler.
Yeah.
Yeah, I let kids, I let like children, like if I see a child crying or something like that, and he just going crazy, I'll let them go before me. But I'm not just letting no regular person go before me. No.
Yeah, the person with the hangnail that came in, you could have
I
went to
ain't
urgent care.
Ouch,
No,
ouch.
They ain't got
not
nothing to
letting
do with me.
nobody besides kids, really. Kids and the older person. Other than that,
Oh,
ain't nobody going before me. Yeah, I don't care what's going on with them. That ain't my problem.
Absolutely.
Yeah.
Okay, so we're getting ready to wrap this up. Anybody have any last words?
I just want to say,
I would
go
like
ahead,
to say, I
Pastor.
think that one point we need to have a conversation about us, and our uh, duties and obligations in a way to what we're supposed to do as far as, you know, we talk about the doctors and the nurses and all that, but how many of us actually talk to them? How many of us actually break down, to the nurses? If we know, I don't know not one person with sickle cell that say that has said that they have heard that there's more than about 7 pages um in the nursing book and the nursing program about sickle cell. Well, if we know that they have limited information, it's up to us to give them the rest.
Exactly.
We here, so it's like, at what point do we do something to combat the 7 pages or to enhance the 7 pages or however it go? Like, at what point do we do something to combat what those 7 pages is even saying? Because I know for a fact that I've been asked questions about. I've been given questions that was in the book, and they was telling me to answer it, but I was telling the person like, yeah, that whole question is set up for y'all to believe that the person ain't even in pain. And so the way that the question went with it was crazy. You know what I'm saying? Like it was saying that if this person is sitting up watching TV, he can't possibly be at a 7. And I'm like, but at the end of the day, what are we doing to tell them? Like, I was able to tell that one person, like, no, that's wrong. That's not. He can't be at a 7. He watching TV because he's at a 7. He's
Right.
watching TV to keep him cool.
Right.
And so at what point, do we go out and talk to the ones who will listen? Everybody gonna say,
Every time.
well, the doctors listen. Now I don't care about that. I'm not here for the ones that won't listen. I'm only here for the ones that will.
Who will?
Hey,
Yeah.
you all know me. I be educating. I don't care who, what, where. I talk loud enough so that everyone can hear me because you never know who you can touch. What
Yeah.
I would like to ask is every person in earshot of this, every time a person says something about a sickler, a medical professional, I would hope that you would ask them, what do they mean?
Right. I
And
agree.
then we give replies. However, if you're in that much pain, you may not care to talk about that, but at least you can ask them kindly, what do you mean by that, please?
Yeah, when you feel better, like when you're feeling better, like bring it up. I remember when when I was admitted, you said this. What do you mean by that? I just want to understand. What do you mean by that?
Mm-hmm.
And my
I,
thing
I, I was
was,
once I was once told, right, like that when you talking to a person and trying to get them some information and they not like really listening or paying attention to you, like, you stop talking to a person that's a fool, basically. And I get that. But if they not acting like a fool, meaning we not arguing, I'm okay. Right? I feel like, no, you should keep talking. Yeah, I feel like keep talking as long as they can hear you. I don't care if they're not listening. Only
right,
reason I say that is because I know for a fact that I wasn't listening to the things that my granddaddy said. You know what I mean? But here we are, years later. I still go back and get some of
Yes.
the wisdom that he gave, that I heard him say then. Like I wasn't trying to hear nothing that he was talking about for real, for real. I was just sitting there because he was making me. Uh, but at the end of the day, some of the things that he said, I was able to pull out of the bank
Yeah.
10 years later.
Mm-hmm.
So,
it
so
comes
yeah, I would keep
around.
talking.
And that's why I say about ancestors and old people. They know them sayings. They those sayings that they say are real because they'll come back around and they'll teach you. But I want to leave everybody with, stay encouraged. It's all about how you feel in your body, how you identify in your body. If you feel good about yourself, having sickle cell, then the outcome of your life will be better. If you don't feel good about yourself and you feel like the world is against you, then that's what you're going to get too. So, with that being said, I would just say if you fit into that kind of category, then seek some help. They have a program called Charisma. It is a study for sickle cell patients. Check it out. Look it up. It has a counseling feature to it. It has a daily track of your pain. It has a diary. It has a app that you can use to learn. It is very comprehensive, and so seek help so that you can be better. Work on you. It might sound like, oh, you're blaming the victim. We always have to change. What about the nurses and what about the doctors? Well, the thing is, if you could be better, then you can help other people to be better. So be your best so that you can help other people to be better, be more effective in your change agent, being a change agent, and I think your life will have more quality, and you'll help change the world around sickle cell. We all in this together.
Absolutely. it's true. You can't change the world unless you change yourself. So all those change makers or the people who want to make changes, just know it's going to take a lot of self growth, self evolution, self reflecting constantly. It's not. It's like, oh, I changed some and I'm good now. I can no. Like, in order to be effective and to really, invoke the things that you really want to have happen in this world, because the way I see it is we're far behind a lot of other illnesses when it comes to awareness, when it comes to like everything. I don't think I need to list anything. I think what's understood don't need explaining. So the key to all of that is to understand you must step outside of yourself and be bigger. And in order to be bigger, you have to grow. So if there is nothing else, I'm going to leave everyone with my positive words of wisdom. Oh, before I do that, Stacy asks that you put in the comments, Felicia, the study link.
All right.
Okay. So but let me get back to it because I was on the roll a little bit.
Get on back to it.
All right, y'all. So I'm going to give you my positive words of wisdom, and I truly hope you understand and apply it, because it is exactly what we were just saying, right? So start where you are, use what you have, and do what you can. Until
Yes.
next time, folks, peace.
Peace.